Simon Clarke is a cellular microbiologist at the University of Reading. I know what you are, Simon. I know who you are. You help us so much on TRT World. First of all, how deadly is Mpox? And I'll give you some context. About 10 years ago, I spoke to an American doctor who was working with the US government. We were talking about Ebola. He said, Adnan, no one needs to die of Ebola if they get treatment in time. So tell us about the death rate from Mpox.
Well, it depends. It can be quite high. There are two versions of Mpox, or the Mpox virus. I'm not clear which type is causing the problems in Sierra Leone. If they haven't had a very high death rate, then it seems that it's possibly the less bad version, if I can put it like that. But if people are not treated, then it can indeed be fatal. But in most cases, it would resolve itself. But that's not to suggest that it's in any way trivial or anything. It needs treatment. It needs attention.
It says on our screen it spreads through close contact. Does that mean that you don't actually have to touch somebody, that it can be passed through breathing, or do you have to, is it about bodily fluids or just shaking someone's hand?
It's actually usually skin-to-skin contact, or contact with something that other people's skin has been in contact with. So like clothes or bedding, it can be aerosolized, but that's relatively rare. By aerosolized, I mean spitting it out of your nose or your mouth. That's relatively rare, but it can happen. Most of the infections arise from person-to-person spread, basically skin-to-skin spread. But as I say, bedding, clothes and things like that can be a vector for the infection.
Just looking at the numbers as reported across Africa up to May, just the 18th of this month, this year, the worst affected countries, the DRC, Uganda, Sierra Leone and Burundi. So we're talking there about West Africa, East Africa and central, kind of almost southern Africa. This is a huge continent. Is there something driving this?
It's there and it's being spread. You know, if the virus can't hop from person to person, then it will die out. It's finding ready opportunities to spread from person to person. They're immunologically what we call naive. Their immune systems are not primed to deal with the infection, either by previous infection or by vaccine. So that's how any infection spreads. If you can stop an infection spreading, you will eventually, and I stress eventually, wipe it out. But what you've got here is a large population of people who are going to get the infection if they're exposed to it.
Okay, forgive my medical ignorance. In terms of, can we call it gestation period? How long might someone have Mpox inside them before they display symptoms? And I'm thinking back to the coronavirus when we were traveling around the world and people were pointing thermometers at us because they would gauge whether you possibly had COVID-19 by your temperature, not by how you looked.
Yeah, it can be up to a couple of weeks, but that depends on which version it is. It also depends on how fit and healthy you are as well. So there is an incubation period when people are asymptomatic but have the infection and could be infectious. Remember those lumps you see on people's skin? They're a good way of spreading the virus, but they're not the only way. It's one shouldn't suggest that you only get infected by contact with that disfigured skin.
Simon Clarke, thank you so much indeed, Simon.
You're welcome.